Today I'll be informing you about the interventions of E-STEM. First, we have thermotherapy. What, when, where, and why. I feel you should use thermotherapy to relax a muscle during a dermatary, such as like using radiation. This type of therapy delivers nutrients to an area slash muscle that will relax and relieve pain, stiffness, and soreness during the connective tissues. Um, what is thermotherapy? Thermotherapy is the use of heat as a therapeutic to decrease the pain and soreness with heat. Using heat decreases the soreness in the soft tissues. This will alter tissue temperature and or targeted muscle region. Another therapeutic thermal therapy, therapy will be the use of cold. The use of cold is another option of therapy to vasoconstrict the blood flow, so you can slow blood movement throughout the injured muscle to fight off the inflammation within the injured area. When would you use thero- thermal therapy? You will use thermal therapy after not after, but during the first 72 hours of the cause of injury. Um, this is after the first 72 hours of injury. You will use hot packs like a hot wrap, warm baths, heat wraps, shock waves, and or radiation. I feel like this is a very helpful therapeutic because as an athlete, you need ice for the first 72 hours, and then heat, which will relax the muscle and decreases the soreness within the muscle. As recipient of using a thermal therapy, I used it in high school with a quad injury, and it really helped the soreness of my quad because I had a strained quad, which happened during a football practice, and I feel it spared the recovery time to get back on the field. Um, when I told you when would you use it after the first 72 hours? Another would be the ultrasound. The ultrasound is a therapeutic type of therapy. It transfers the vibrations of motion through sound, which can be heard through the ear. The sound is actually 16,000 to 20,000 per second per unit. The type of therapeutic are diagnostics, therapeutic, or surgical. This type is not used on very much of muscles, but you can use it type when you go to the hospital or trying to measure skin, viewing skin, or using a light, which helps determine the factor of seeing a baby within a mother that is pregnant within the hospital, which is ultrasound. Um, I feel it's ineffective using for injuries because it really doesn't show you the depth of the injury. It doesn't show you the soft tissue. It doesn't show you the deep muscle tissues which could be injured in the phase. Um, I feel it's ineffective with any injury. Um, the next one we have is electrotherapy. Electrotherapy is the therapy which exhibits like magnetic waves to increase the blood flow throughout the injured area of the muscle. Why would you use electrotherapy? You would use electrotherapy for muscle contractions to increase the blood flow within the injured area to nurse back to health or stimulate the sensory nerves to moderate pain. A patient will use this type of therapy to increase the local blood circulation throughout the injured area muscle with the bruising to spread the bruised blood cells or blood that's occurring to spread throughout the muscle. Why would you use it? You will use this to increase range of motion and muscle rehabilitation for athletes such as football, basketball, and track athletes, and or more athletes in other sports. I feel this is very helpful because going through my quad injury, I actually use electrotherapy as well to increase the blood flow. Um, I had a lot of bruising on my quad, which was very painful. And using the electrotherapy, it actually helped spread the bruising. It spread the blood. The Yeah, spread the blood throughout the muscle to actually decrease the pain and soreness I was actually feeling throughout the process of my quad injury. Um, it's very helpful for athletes that are having or swelling of the muscles, because swelling of the muscle is vasoconstriction, which is blood stoppage, and it's an inflammation within the area. So in order to decrease the inflammation, you have to use these type of therapies to increase the blood flow to push out the stoppage or increase the blood flow throughout the injured area to receive more oxygen to the muscle to help heal the muscle. My last therapeutic is cryotherapy. What is cryotherapy? Cryotherapy is the use of ice to decrease the swelling of an area of a muscle, the swelling of an ankle, a sprained ankle, or an injured shoulder, or say for instance you sprained your shoulder or dislocated your shoulder, um, a knee contusion. Ice cryotherapy can actually go on any type of injury to actually decrease the pain and soreness. It numbs the area first for the first fifth the first I mean after the 10 minutes, or first after the first 15 minutes. The first 5 minutes you will experience a coldness type. Then the next 5 minutes it will actually subdue from the ice, and then after that it'll be numb to sensations of stopping the blood flow or stopping the inflammation from spreading throughout the injured area. Cryotherapy is using the ice to decrease the swelling of the area that has been injured, such as like an ankle, as I said, um, dislocated shoulder, which will precede the swelling of the area, swelling of the knee, and or muscles that is strained as well. Why would you use cryotherapy? Using cryotherapy helps circulatory blood flow and helps decrease the chances of reoccurring injury. Using cryotherapy, you will put the ice pack or any ice or cold type of sensation on the muscle or injured area, 15 to 20 minutes on and 30 minutes off. When would you use cryotherapy? You will use cryotherapy within the first 72 hours to decrease the inflammation that spread throughout the injured area. The types of cryotherapy is crushed ice in a bag, ice pack, gel pack, powder pack, which is chemical, and the best form of cryotherapy is the crushed ice bag because it prevents the ice on top of the injured or swelling, which decreases the pain. Gel pack, I would say, is third next. Next to the artificial ice pack. Um, Powder type for chemical, I feel, is not recommended. It should not be recommended because chemical to naked skin, it shows it burns the skin, which is a negative effect. Um, I trust the crushed ice because, as I say, the quad injury, I use electrotherapy, cryotherapy, and thermal therapy to to decrease the time from being off the field and on the injury list. The ice helped the pain drastically. It took away the swelling faster than me not using ice to heal from an injury. I had stiffness, but slight stiffness during the first 72 hours of it. Pain, pain was not very intense because of the lack of inflammation from using the ice. So I would say cryotherapy is a great therapeutic way to actually coming back from an injury. Thank you. This is my eSTEM video. Anything, anything but a project. Thank you. I'm Edwin Wilson. Thank you.